Okay, so today we're going to show you how a chin liposuction is done. Now, if you don't think that Danielle needs any liposuction, you can look at her pre-operative pictures for an evaluation, and she believes that she needs liposuction done, so that's what we're going to do today. Now,
my chin melts into my neck.
she says her chin melts into her neck. Anyway, this is an awake procedure, as we always do awake procedures, because it is the safest way to do a procedure. Patient is fully conscious, aware of what we're doing. We do the same techniques for liposuction, lipoabdominoplasty, Brazilian butt lift, vaginal surgeries, chin liposuction, and any type of revision surgeries. Now, as a point of reference, if you've ever seen Dr. Pimple Popper, when she does her lipoma removals, she generally will use a tumescent solution, which is what we're using today as a modification. Now, this can be done by a simple cannula to suction off the cannula, but I'm going to use the suction machine today, simply because I'm going to use a little bit more anesthetic to distinguish the certain areas of her jawline and her neck, because you have to be very careful in these general areas, especially when there's not a significant amount of fat that has to be removed. But it's better to tumesce the tissue, hydroseparate the tissue with a tumescent solution. It works very well as an anesthetic, but also hydroseparation to keep the cannula away from sensitive or important structures and vessels. All right, so she's already been prepped. I've already done her chin, or her cheeks, and her neck with a combination of betadine and HepaCleanse. So the next thing we're going to do is we're going to numb her chin, because that's going to be the entry point. So in numbing the chin, we're going to take a. Now I've already cleaned her neck, but I'm just going to try to keep my hand in this general area where I'm going to be working. So we're just going to make a little pinch, 1, 2, 3, and pinch. You'll feel a little burn, and then that's going to be a wheal that's created. This is the point of entry. All right, so as with any procedure with awake, the hardest part is the numbing, because this medication does have a stinging effect when it's first injected. Now, using this big old cannula, this is going to be allow me to entry from a single point, where I'm going to go ahead and numb from the chin on down. So I've already numbed on the chin area, but we're just going to go ahead and do it again. This time pressing a little harder. And I'm going to go ahead and numb to the chin, to the jawline. And again, I prefer to lift the tissue up when I'm doing this and inject. And so you can see how thin this area is. So you have to be careful exactly where you're putting that cannula or the needle.
Are you numbing?
Mm-hmm. You will. If you don't feel the actual needle, then it's numbing already. Turn your chin this way. Now again, this is it seems to be a lot. I don't need this much, but as I said, in thin patients, you want to make sure that you separate the skin from the underlying tissue and vessels. So the fact that we're using more than necessary is actually good. So we're going to go ahead and make our small incision in the chin line. Pinch. That's the incision. Next, we're going to work on one side. So I'm going to work this way. So the cannula is this big. It has 4 ports. And I'm just going to run it into the tissue. And I'm developing her jawline, the characteristics of her jawline. However, not going up too far on below the jawline, because you don't want to distort the natural cheeks that she has. Now again, this can be done, turn your head. This can be done by hand cannula with suction. I prefer to use the suction device. A little bit on that. That's more than we need. Okay. So next, we're going to go to the other side. Now, I do use Kybella, which is a fat-reducing solution. However, I found the chin liposuction is superior to Kybella. But if you're not comfortable with syringes and needles and you're just nervous, Kybella can work, but it can burn and swell up for a number of weeks. So most people will not want to do that.
In the back.
Okay, well, we're done.
And in some cases, maybe same day consult.
Yeah, same day consult,
Same day lipo.
same day lipo. Corner jawline, and that's the great thing about the patient talking to you, is that they can tell you, even though it looks perfectly fine from my end, she can tell me if it's going too far, if it's getting uncomfortable, and that's what we need to do. So I'm developing that jawline for her, grabbing underneath. Since I don't want to go back on this procedure in case I miss something, that's why I'm taking my time. Normally this is a 5-minute procedure. Like I said, it takes longer to numb than it does to remove the fat. And her main complaint is right here underneath her chin. And so I'm making sure that I'm getting there. We're going to stop there. And now we're just going to close. It's a single stitch or 4-0 micro PGA.
You think you got it all?
I think I got it all. Yeah, I went 3 or 4 times.
That easy.
Straightforward. And again, she's fully awake.
I didn't know anything, guys.
And I'm simply going to go ahead and do very tiny mark. Just reapproximating that skin.
And this will
Dissolve.
Yeah.
This does not have to be removed. It'll dissolve by itself. If it's still there in a week, I'll go ahead and remove the stitch.
They want to know how long is recovery for pain and what do you send home for pain control?
Motrin and Tylenol over the counter. They'll be sore the next day. A little stiff maybe.
But you can go to work.
You can go to work.
Yeah, we've had they go to work same time, go work back to work same day, I've seen. Or next day. But I'll update you guys later once the numbing wears off.
They want to know what happens to the skin afterwards. Does it?
It retracts back.
You have to wear
I'm going to show you next what we do there.
Mhm.
And